Good afternoon, everyone. Can we formally open the meeting, please? Good afternoon, everyone.
Good afternoon.
Can we formally open the meeting? Thank you. So, first item on the agenda is apologies. So, I will ask Rob if he will just go through that for us.
Thank you, Chair. So, just to note that we've had a number of apologies which will be recorded in the minutes. Our Rochdale representative, which was today going to be Steve Rumbelow, has had to return back to Rochdale. Technically, that means that we have 9 of the 10 localities represented in the room, as well as the Combined Authority and the Health and Social Care Partnership, which technically means this meeting isn't quorate. There are no formal decisions to be made this afternoon, so that doesn't give us a huge issue in terms of decision making, but we'll have to formally approve the minutes next time, Chair. But we can run the meeting as per normal process, but just for the record to note that, and we will follow that up with colleagues in Rochdale to make sure we are always quorate moving forward.
Okay, thanks for that, Rob. I have been asked to remind everyone, when you speak, could you please use the microphone? So, I don't have any other announcements and I haven't been notified of any urgent business. Can I ask whether anyone has any declarations of interest? There is a form for declaring that which is circulated with the agenda, so if you can make sure that that's handed in. Thank you. So as Rob says, we can't approve the minutes because we're not quorate, so that'll be dealt with next time. So we're now going to move on to item 5 on the agenda, which is delivering our population health ambition, the role of the Greater Manchester Joint Commissioning Board. And if I can ask Sarah Price, the Exec Lead for Population Health and Commissioning, to take us through that report. Thank you, Sarah.
Thank you, Chair. For those that remember the meeting in July, we had a discussion more broadly about population health and the improvements that we've been able to achieve over the last 3 years with the application of the population health plan and the work that we're starting to think about in relation to developing a population health system across Greater Manchester. In October, the JCB executive had the opportunity to think about what the options for the commissioners across GM to really address some of those issues and think about what the priorities within that should be, because the challenge that I was given was where should we be placing our emphasis and what should we be focusing on. So the paper that you've got in front of you, for those that were at the executive, will be very familiar, but in order to ensure that the whole of JCB have a view on that, we thought we'd bring it back to this particular meeting. So the 3 areas that I think the JCB needs to take a very important and leading role are around health inequalities and the reduction of health inequalities across Greater Manchester. That's across the conurbation as a whole, but also within localities and neighbourhoods as well. Investment in prevention. We've been very lucky in Greater Manchester over the last few years to have money to invest specifically in prevention, and that's been both within locality plans but also at a GM level. And the question, therefore, is what next for prevention in Greater Manchester? And the third area is something that we've been talking more broadly across the partnership with the Combined Authority and others around, is how do you create social value? How do you ensure that the populations that we serve benefit from the improvements that we're able to make and the prosperity of our city region so that they really can improve their health and outcomes as a result of that change in prosperity? So what's the role of social value and anchor institutions, the NHS being the largest employer across Greater Manchester? What can we do differently? So where do we want to use the power of JCB? So this unique position that we're in, where we've got managerial, clinical and political power coming together, how do we want to use that in the most appropriate way? And are these 3 broad areas where we're going to have the greatest influence? What should our key objectives be moving forward? And some of the discussion that we had at the executive was about that. And how do we ensure that we've got the right resource identified to support work going forward, particularly post March 21, when the population health programme budgets run out. Some of the programmes definitely have been very successful, like the tobacco work. How do we continue with that? What funding model do we need to put behind that? How much do we do at locality? How much do we do at a GM level? And how do we create a balance in the longer term so that we aren't looking for return on investment, for example, within a 12-month or 24-month period like we do with lots of things, but take a much longer term view, like places like Wales, Scotland, New Zealand are starting to do very specifically to ensure that we're protecting the future of our young people, generations to come. So making sure we've got system join up at both GM, locality and neighbourhood level, I think is going to be absolutely key, particularly if we're going to see a reduction in health inequalities. And the Marmot work that we're undertaking at the moment will help steer us to where we ought to place focus and help us identify some of those key priorities. So really, Chair, this was just to make sure that the whole of JCB were familiar with the direction of travel and to ask for the support in those three areas as a focus for our attention over the coming months, which we would be able to bring something more detailed back in the new year.
Thank you very much, Sarah. Can I ask, does anyone have any comments or questions for Sarah? Yes, Tom.
Thank you, Chair. We had a discussion last week at our Health and Wellbeing Board about the GM population health and also our own priorities, and they're broadly similar. My two colleagues from Stockport will be very aware of my liking of the 368 bus route in Stockport, which when you leave the town centre and go away, every 2 stops or so, you get 2 extra years in life expectancy till you get towards the end of the route. And I think one of the things that we need to, and I've used this as an illustration before, I think one of the things that we need to reflect, and we certainly do, is that Stockport looks very well in the figures, but it's very polarised, and that masks some of the things. So that whilst we appear to be doing a lot of good things, and we are, we need to make sure that we also recognise that there are pockets right round the borough, and I'm sure this is true for other places as well, where we need to be concentrating to do the additional bits to make sure that they're just not hidden.
So as Sir Michael would call it, proportionate universalism is definitely something we should be focusing on. So making sure that for some things we need to do it for everybody, and for some things we really need to focus our attention and our resource on those with the greatest need. And that'll vary by locality, by neighbourhood even. And certainly if you look at the gap in life expectancy within each of our localities, that's clear in all of them, not just in Stockport. You know, that's clear. So coming up with a programme that is both reflective of need within communities but also across the piece, I think is something that we need to think about how we address. And that creation of social value, using our anchor institutions to make and Carolyn's not here just at the second, but she certainly would be able to reflect some of the work they've been doing in Oldham, where they've been looking at how many people they employ within the council from their most deprived neighbourhoods, and it's not very many. So how do we create a different approach and make sure that we're using the power of our organisations to really build up and support our residents? So definitely that's something that we need to start thinking about. Well, we're already doing it in some respects, but we need to continue to do that.
Sarah, Warren, you had a question.
Yeah, I think we should all be very familiar with this paper because it's been to us a number of times. It's got some very hard numbers in there, very hard facts in there, which are hard to accept. 20 years difference in healthy life expectancy in 2019. It's very hard to accept that. And I think it's something that we should really take up this challenge, because there is some optimism, because we haven't had this partnership before. This key partnership that we have is real opportunity for us to do something about it. We mentioned Professor Marmot. He gave a lecture at the Royal College of GPs only a few weeks ago. It's on YouTube, it's well worth listening to. But one of the key things he said, which really I was struck by, is we're very good at treating people, but then we send them back to the environment which made them sick. We keep doing that all the time. So I think this partnership is a great opportunity to actually change that environment. We know health and care is a small part to play. It's all the other stuff that we talk about. And this partnership here should be able to help us to address that. And I think the other thing is that we need to really explore and understand what we mean by prevention. Because there's a clear ask in this paper that we need to re-look at this investment of prevention. And that's quite a challenge in the current financial landscape. So if you're going to do something about it, we're going to radically realign our resources and really focus on prevention. So if you really mean to do what we says in this paper, the 3 priorities, I think, we can't just talk about prevention anymore. We've got to start really realigning.
Thank you. Sarah?
It's a challenge and a half, yes. One of the things that I hope we'll be able to bring to the partnership at the end of the year is the work we've been doing on creating a population health system, which might support some of the place shaping that we need to do in order to create the environments in which people feel that they can lead and aspire to healthier lives. So creating that environment that allows people to take more exercise, to eat more healthily, and to be able to have a good job that they can sustain, to live in a home that's warm and dry and supports them. So that place shaping work is really, really key to that, and that's something that the whole partnership definitely has a role in. And in terms of prevention, I think this, how we realign our resources and balance that, what we need to do for the longer term versus what we need to do for the here and now, is always been a challenge, but is always something that we need to come back to, that, that we'll be running around in the same circle unless we do something different. And it's our opportunity, isn't it, now, to start to think about how we do that with investment of any funds we get through the long-term plan, for example.
Yeah, thanks, Chair, and thanks, Sarah, for the paper. It struck me when I read it that last week was National Living Wage Week, and I'm very proud that in Salford we became one of 2 living wage cities in the country. And whilst we have achieved some penetration in Greater Manchester around public sector organisations who are accredited as living wage employers, I think we've got a lot further to go, and it is something that we could consider actively as a set of commissioning organisations as to whether we, and I know last week Manchester City Council became a living wage employer, whether we more actively promote us as public sector organisations paying the living wage, particularly given the connection that has to improving health and well-being.
Don't think anyone's going to argue with that, Anthony.
Sign up.
Thank you, Chair. One of the questions I'd got, Sarah, was about the numbers of people that we quote as employed in care across GM, Greater Manchester. My sense is that feels like, I'm not sure who we're including in there, but it doesn't feel as if it's enough. I was expecting there to be a bigger volume. And so what I'm wondering about is whether that's the statutory sort of provision in terms of hospitals, community services. Is it general practice? Is it pharmacies? Is it... No. So again, I think it would be helpful to think about social value and think about all of that workforce who are helping, domiciliary care workers. Why shouldn't we be thinking about the whole volume of because actually that will be a big number of people across Greater Manchester, and I think will be a great ambition for us to try and tackle some of that. It may be that we don't need other prevention methods if we can help our own staff to raise their expectations and add value. So,
Tom, I think Tom wants to just come in on that.
Yeah, just a quick one. So we are likely to become the first designated Marmot City region in early 2020. And so Sarah's just really trying to understand how much of an impact that's likely to have, how much has it transformed population health strategies in other cities around the UK? Because, I think we're all firmly signed up to population health, wider determinants of health, and, everybody around this room really wants to see change, but I sometimes feel that it's pushed to one side because we've got so many here and now things that we've got to deliver on. And, so Transformation Fund, we had 30 million funding, which was fantastic, but actually it was only a 15th of the overall pot. So we only spent 6% on population health and prevention. The rest we spent on illnesses. So, how much of a galvanising impact do you think this can have?
So, I think it's what we're going to make of it, I would argue. So his voice is a very strong one. The levelling off of life expectancy, not just here in England or the UK, but across the world in developing countries, is something that he's very vocal about. And he's very clear. He's just done a big piece of work on the Americas, which there's learning to take from that. But I think if you take somewhere like Coventry, where he's been working for a very long time, the sorts of things that are making a difference there are leadership and coordinated leadership, which, as Wirren points out, we've really got in spades here. So we've got a real opportunity to do things differently. I think a lot of what he and his team have said to us is that we're doing a lot of really great stuff, that a lot of what we're doing is in the right space and we're looking at the right things, but it's how far and how fast we can go. And so he'll come back with some areas and challenge for us. And I think one of the things that some of us are trying to do is to make sure that he really challenges us and doesn't just give us the kind of general high-level messages, because I think we need specific, really. And then in terms of making sure we've got the right messages in the right rooms, I think that's up to us to then take what he tells us and take it out into our system to really highlight what we want to do differently and apply resource appropriately as a result of that. So I think there will be some challenges. There'll be a lot that he'll be able to point to say we're doing the right thing. And the other area is about measuring going forward. This is a baseline. So how will we know that we've made a difference? I think is going to be another big thing for us to be able to do. I don't know, Andrew, whether you, from your point, sorry to pick on you, but I don't know from your point of view whether you.
No, I'd echo that, and I think I anticipate it will be a critical challenge and a call to arms as well to reinvigorate not just the commitment in this room but across the wider system. So we've got high hopes of the work that Michael's doing, and it responds to some of the questions that have been posed by other colleagues in terms of how we're seriously going to progress this issue of investment in prevention. So it'll be a challenge but also an opportunity to raise the profile and a call to arms.
Just as a final thing, I think the other thing that we hope to be able to do is to produce a response to whatever Michael comes up with, and should the Mayor be re-elected, I'm sure he'll want to support that and produce a report that sets out how we as a system are going to respond.
Sarah, you asked us about the role of JCB. I think the JCB's got three roles. One is to identify those areas where we can add most value. The second is to identify those areas where we can only achieve that value by working at a GM level. And the third is also to identify those areas where we can only achieve that by working in some combination of political, managerial, clinical leadership, because if it doesn't require those things, we should do that work in our localities. So instead of trying to cover absolutely everything, if we identify what those few things are that we can do well as a JCB, then I think we've got a chance of making good progress.
Thank you. I think they are very good points. Are there any further comments on the report? None? Well, thank you, Sarah. I think that was a very useful report, and I think the areas that we have to tackle, they're not new to us. They remain areas that we've been trying to deal with for some time. I do think we have made progress, but of course we've got to continue to make that progress, haven't we? Health inequalities are still an issue in every district, I would suggest. We have the extremes everywhere, and we must address them. And prevention, of course, is the way forward. You know, we can prevent people from becoming ill, you know, and having those awful, dreadful diseases. Then, of course, you know, that takes the strain off the system itself. And social value is very, very important. So thank you for the work that's been done so far, and I'm sure we look forward to ongoing reports. Thank you.
Thank you very much, Chair. So, yeah, the report you've got before you picks up specifically the actions from the workshop that I think most people in this room attended on the 4th of October, which Tom, Brenda and myself led. And at the end of that workshop, we agreed a series of actions, and I've tried to include updates on each of those actions, some of which are to do with the actual operation of this meeting. So if I can refer people to the table at 2.1, one of the things that was said quite strongly in that development session was that we need to create more opportunities for us to work together in a developmental way. And the proposal that we've developed since then is to move to the quarterly cycle of meetings, which is set out in table 2.1. That would be that we meet in public in month 1, that we have an executive meeting in month 2, and then a development session, a members' development session in month 3. And in line with the discussions at the workshop, if I think I've captured them correctly, it is proposed that all members are invited and attend all of those sessions. So we don't just have people coming at the end of the process, we have people in the room as the process emerges and develops. So that's a key recommendation that I'll come back to about the actual operation of the group. I'm not going to go through all of the other specific items, but I'm going to pick out a few things as I go through. We've just had a conversation about population health, so that was another key thing that came out. I wanted to mention that in terms of public service reform, there was a very useful session that Sue Long chaired last week. It was actually the first session between the wider leadership team and the Commission Leadership Group talking about public service reform. I think that got off to a very good start. We've agreed further work, and the plan would be to bring a paper back on that topic to a future Joint Commissioning Board executive early in the new year. So we're moving forward on that. In terms of the bottom one on table 2.1, it talks about inclusivity and inclusion. I just wanted to take the opportunity to mention, and we will send a briefing out to members separately, but you will remember a few months ago a presentation on the Trans Health programme that we supported. That programme that was referred to there, the procurement process for that has actually started now and is underway. So we'll make sure all members receive a briefing on that later this week. But I just wanted to let you know that that was the progress has been made in that area. And you will see there that there's a pipeline of further papers on a range of subjects which will come forward in future months. The Joint Commissioning Board, so those are that's the meeting and specific items for the JCB. In terms of our wider leadership role, I think there is some significant work taking place which is spelt out in that table. The one thing I'd, with permission, Chair, like to raise in this item is that, as I'm sure colleagues are aware, Anthony, to my right, is shortly to take up a secondment role within NHS England North West, which means that some of our existing leadership arrangements, we will have some gaps in them. And I just wanted to take the opportunity this afternoon to set out the proposed plans to cover a number of those gaps. So Anthony's secondment will be covered on an interim basis as Steve Dixon, the Chief Financial Officer at Salford, will become Interim Accountable Officer at Salford to cover Anthony's period of secondment. And Steve Dixon has kindly agreed that he will continue to be the lead officer for Gmca United. Working alongside Sarah, Steve will be a lead accountable officer around climate change and sustainability, and has also very kindly volunteered to pick up the previously vacant lead role for elective care reform, working very closely with CAF. So we're grateful to Steve for that. In terms of other gaps, Anthony is our lead for urgent and emergency care, and Martin has, I think the right word is volunteered, Martin, to take on that lead role, which again we mention and hope for endorsement this afternoon. And we are currently doing some work on the longer term leadership arrangements around improving specialist care, which is Anthony's other lead area. So just to sort of shoehorn that one in under that item, Brenda, I just thought it was worth just sharing those proposals, and at the end I'll perhaps just come back and mention those just to make sure that people are comfortable that that's the basis upon which we proceed. And in terms, moving forward back to the table at 2.3, in terms of Joint Commissioning Board development, we have formed a task and finish group, and grateful to colleagues who attended the first meeting of that group last week. I think it was a very positive meeting, and we had some very useful discussions, and basically that meeting last week is what led to the production of this paper. And in terms of the next stages in our organisational development process, I've got an initial exploratory meeting on Thursday of this week with a potential partner who might be coming to come and work with us around that. But we're pursuing one or two options, and we'll come back to that in the months to come. But the idea would be that when we run the first of our development sessions in the new year, that would be done in collaboration with a partner, an external partner. Through you, Chair, I'd ask the Joint Commissioning Board to receive this update. Hopefully people recognise it and accept its content, that we are making appropriate progress on the things that we said we would do, to specifically consider the proposal for a revised cycle of meetings, with all members being invited to all of those meetings. And then the third point I would add to the two on the report are just to note the revised leadership arrangements, taking into account Anthony's imminent departure into his new role. So I'll stop there, and happy to take any questions through you, Brenda.
Okay, thank you. Any questions for Rob? None? Can I take it everyone is happy with the paper? Thank you very much. Thank you, Rob. And so, Rob, if you can give us an update report from the Joint Commissioning Board Executive, item 7.
Thank you, Chair.
Thank you.
Thank you, Chair. So this is a piece of due process. We always provide reports from the Executive back into the full board. That is the summary of the meeting that took place last month, and I'll take the report as read, and happy through you again to take any comments or questions on that.
Okay, thank you. So the report is read. Anyone got any questions on it? None? Okay, thank you very much. Not being advised of any other business, there are no urgent items, and so I'm sure you note the date of the future meetings. Will these be the same now, Rob, with the changes that you've just
so
discussed?
The 21st of January will be the same. It's likely that the meeting in March will become a development session, so there will still be we will be still getting together on that date, but potentially in a different sort of fora. But certainly the 21st of January meeting would be a month one meeting in public of this board. Yeah.
Thank you for that clarification.
Thank you.
Well, that was a good half-hour meeting. So thanks everyone for your attendance. And I think it's probably appropriate to wish everyone a very happy Christmas. all the best for the new year. And just hope you go out smiling and have a look at the Christmas markets out there. I'm sure they're very, very good. Thank you, everyone. Thank you.